Dear friends all over the world, it's my great honor to attend this webinar. My topic is HIFU treatment for adenomyosis and pregnancy outcome. I'm from Shanghai First Maternity and Infant Hospital, Shanghai, China. Shanghai is a beautiful, magnificent, and very international city. HIFU system installed in 29 countries already. The previous speaker, I believe, already have introduced the principle of HIFU treatment. As I summarize here, convert electric energy into acoustic energy through a transducer. So I will not elaborate again. Global Roommate Service Center in all around the world, just like blooming firework. Our journey beginning in 2050. As we always mention, is maybe a coincidence, but once we choose the HIFU journey, we should hold very strong enthusiasm. Accident and coincidence sometimes become an eternity. We gradually increase the cases. Up to now, we already finished more than 2,000 cases. In whole China, we are located in third line. Every year, more than 400 cases. From this picture, we can clearly see our patient focus on myoma and adenomyosis. Especially from 2018, most of patients we treat are adenomyosis. We established a three-step treatment. The first step is HIFU. Second step, we use the traditional medication like GnRH, digesterone, mifepristone. We will, depending on the patient's condition, to choose a suitable medication to control the menstruation, to help hold the size of the uterus, shrink to normal size. Third step, we use Mirena. We published this paper in 2019 for three-step therapy. From this picture, we can see before treatment, here is a very typical posterior adenomyosis. The second picture, picture B, showing 1 day after HIFU, we can see the lesion nearly 90% destroyed, no blood supplement. Just after 18 days, we can see the normal size of uterus. From this picture, we can feel the beauty of the non-invasive HIFU as miracle as a work of art. The normal size of uterus in the pelvic wall is just like beautiful turnip. HIFU procedure usually not very complicated. One doctor from Taiwan, she mentioned, like a very young doctor, just use 2 weeks can learn her whole procedure. The first step is skin preparation. We need a very clean abdomen. This step usually done by nurse. Second step is pelvic MRI evaluation. The specific lesion location and the vascularity of the lesion. This MRI, just like GPS navigation, it's a very important guiding when we're doing the whole procedure. When we find the sensitive area and the correct position, We put the energy on, and we can find the green scale change depending on the real-time assessment. The HIFU technique, the very simple thing is click the mouse, but sometimes click the mouse to need very good luck to appear a white mess, just like snowflakes or popcorn. This is a case we had a very successful ablation. The first second, we saw the grayscale mass. During the procedure, the ultrasound guide will make the important role, just like eyes of the ultrasound. We put the balloon to squeeze up the bowel to put all the procedure safety. The green point here, we will put the area of which we feel it's safe and sensitive. The procedure is very simple. So find the correct area and put the energy, then we can see the white color. It's a successful symbol. So after treatment, we will measure the effectiveness. The first symptom is pain. So from this chart, we can see improve the VS and VRS score. The second important is menstruation. We can see the reduced menstrual volume score. The third is uterine volume. We can see dramatically reduced month by month. From here, we can see localized and diffusion adenomyosis show significant uterine volume decreased after HIFU treatment. Hemoglobin also can increase after HIFU ablation. Here is a very important biomarker, very traditional marker. CA125 level was compared before and after treatment with HIFU. Localized and diffusion types both can show a very significant decline. The three-step approach combining HIFU, GnRH, or other any kind of medicine can stop the menstruation, cause amenorrhea, and the Mirena can successfully treat the adenomyosis. It has lower risk of hysterectomy, safe, effective, and efficient. It can improve quality of life, especially for patients with localized adenomyosis. I want to share several successful cases. The first case, the patient, 42, 5 years dysmenorrhea associated with hypomenorrhea. She had a 3 to 6 injection before, also put Mirena, but all failed. From this picture, we can see the successful ablation by HIFU. And here showing our step 3. So the second step controlled by medication. The third step, patient will receive DNC and hysteroscopy. This is the old traditional way, but now we change the style. So also we can see the tissue from uterine cavity. The pathology result is higher grade degeneration. It's also the evidence to exclude out the malignancy tissue. Now we usually to take TCRE, cervical resection of endometrium. This is for the patient without desiration for pregnancy. This video, we can see the resection of anterior endometrium. Second, for posterior endometrium, we usually resect all the endometrium. So here we can see there are no any endometrium inside. It can cause patient without menstruation or just very little, but no pain. For adenomyosis, the final choice usually menstruation or uterus. Second case, the patient is 31, severe dysmenorrhea and menorrhagia for 4 months. We can see the irregular ablation area, but also is belong to the successful case. For adenomyosis, sometimes we should protect the endometrium and the bowel. So we should control the whole dose. The safety is very important. This is the third case. We can see the posterior lesion, and the second picture is 1 day after HIFU, the heart-shaped ablation area. 6 months shrinked smaller, and the 16 months post HIFU, we can see the nearly normal size of uterus. This case patient 22 years, severe dysmenorrhea for 4 years. Adenomyosis always have a long time dysmenorrhea. So this case we can see the ablation area also very successful. The patient is 29, 1 year of menorrhagia, JNRH 6 times. So this story mostly are the same. JNRH, Marina, any kind of traditional medication therapy, all failed without symptom improving. For some patients, Marina will not have any effectiveness. The diagnosis is diffusion uterine leiometasis. This case is 13 years, 4 years of menorrhagia, but this is belong to the myoma. But this picture, we can see the size of the myoma gradually smaller. So I want to share our successful HIFU cases just. Though many doctors asking, the HIFU can influence the ovary reserve. The answer is no. HIFU treatment does not affect the ovary reserve. The function will be kept very stable. Pregnancy outcome for adenomyosis, we found several papers. Here we can see from 2010 to 2050, 68 MRI confirmed EM patients with fertility desire were treated with HIFU ablation in Suining Central Hospital. This is the biggest hospital in China. Amongst 68 cases of adenomyosis, 62 cases were diffuse type and the 6 cases were focal type. The mean age of the patient was 37. BMI is 22. The mean causes of disease was 5 years. And the mean lesion volume was 36. So from here, we can see 54 succeed in pregnancy after HIFU. In 54 patients who had a successful pregnancy, there are no symptomatic uterine rupture or rupture during pregnancy or delivery. HIFU ablation has no obvious adverse effect on normal uterine wall and does not increase the risk of uterine rupture during pregnancy and delivery. So they are not necessary to worry about. Must accept the C-section. HIFU ablation may improve the uterine movement and uterine cavity by ablating lesion, just contributing to fertility. HIFU ablation results in a relief of clinical symptom in adenomyosis patient with fertility desire. No increased incidence of complication during pregnancy or delivery. So we usually use the combined therapy. There are not any single technique or any single medicine can heal the adenomyosis. But now our combination therapy includes HIFU treatment. After HIFU treatment, we use kind of medication and then TCRE and put marina. But also can take other technique like robotic or laparoscopic. Also, open surgery had its some advantage when we have some special cases. In our center, pregnancy outcome coming also very well. We had a totally nearly 100 cases from 2050 up to now. Natural pregnancy, 77 cases. IVF, 19. So we have many patients sending from the other IVF center. About C-section and the normal delivery is depending on the desiration of the gynecology doctor. Some obstetric doctors, they worry about happen uterus rupture after HIFU, but they are not necessarily worry about it. It will not influence the construction of the uterus. This picture, we can see our first HIFU baby born in our hospital. The baby is 28 months, and they checked the MRI just for some, I forgot what's the problem, but not for the myoma. This patient had nearly 4 centimeter myoma, so we can see the myoma shrinks gradually during the pregnancy. This is our first case, but this case, our 1000th HIFU cases, and she has a normal delivery very successfully. Our 1000 cases HIFU baby. Usually adenomyosis and the endometriosis, the woman has special personality, full of anxiety, and some patients suffering from depression. So very important thing to do some psychological training. So we also try to learn some IPT training through the psychology doctor. So we create the uterus guiding club to help the patient, and the older patient can sitting together, have some interesting communication. So protect the uterus, we think can protect the dignity of the woman. Also, the patient's character can change. So also can create the very harmony life in the family. My personal journey, I start in the very traditional open surgery nearly 20 years ago. I'm in gynecology already 25 years. And then from 2000, I learned laparoscopic surgery. I learned the primary technique in Melbourne University with Professor Peter Ma in 2004. And in 2008 to 2009, I learned the advanced laparoscopic surgery with Cameron Izzat in Stanford University. Also learned a very primary knowledge about robotic surgery. And also my teacher in China, like Professor Liang Zhiqing, Professor Yao Shuzhong, Professor Chen Jie. The 3 teachers are my laparoscopic supervisor. Then from 2015, I accept the HIFU technique. So I thanks all my teacher in my learning journey. Also my laparoscopic very important supervisor from Melbourne, Sydney, Professor Felix Huang. Up to now, he always give me the encouragement to develop HIFU. This is our team. And in summary, HIFU has the advantage of non-invasiveness, lower complication, quick recovery, and the retreat capability. HIFU can selectively ablate the concentrated granular muscular lesion, reduce the scope of the lesion, and abrogate the functional ectopic endometrium, so as to improve the symptoms such as dysmenorrhea, the most important symptom the patient we are facing, heavy menstruation, the second symptom we should to deal with, and the uterine environment. The very important thing is uterine environment because some patients had the pregnancy desiretions, they always facing the abortion or the IVF several time failure. So change the environment is very important. We have many patients larger than 40. They wouldn't like have a second baby or they have no any desiration to pregnant again. But after HIFU treatment, they pregnant several times. So it's not a good result. The patient said the side effect of HIFU is to be easily pregnant. For women with pregnancy desire, HIFU also has a treatment intent of improving probability of successful pregnancy and delivery. So thank you very much. Welcome in the future after pandemic gone, to come to China. All the best for all of you all around the world. Thank you very much.